If you are a stroke survivor but have been left with a physical impairment causing weakness to one side, then the 6 exercises in this video will help you build back some functional strength. Hi everyone, and welcome to Exercise for Health, and this workout is intended for anyone who has been left with some form of weakness on one side of their body as a result of a neurological condition that affects their ability to carry out normal daily activities. Due to the vast differences in neurological impairments from one person to the next, it's impossible to tailor this exercise program to everyone, so some exercises may feel more beneficial to you than others, and in some cases there may be an exercise I show that would be considered inappropriate for you if the risk of performing the exercise outweighs the reward. So please only conduct the exercise if you're confident it's suitable for your current condition, and as always, check with a health professional that knows you if you're unsure. To take part in this routine, you will first and foremost need a support that you can use to hold for balance purposes, so a kitchen worktop or a stair banister are good examples. You will need a chair to start and end the exercise routine. You'll also need a low step that could be the bottom step of your stairs, and a light therapy band that you can anchor to a point near your support. Please use your AFO, FES or walking aid if you have one. Although this program is mainly strength and mobility focused for the weaker side, meaning that we won't be moving around very much, you may need the aid for transitional purposes between exercises. We will start seated for some mobility exercises before standing to go through the main strength exercises. However, if at any point you get tired and need to rest, please pause the video and sit down for a bit until you feel ready to move on. And if this routine is too much for you now, you can always try one of my other routines in the Exercise After Stroke playlist that might be more manageable to start with. So get yourself and your equipment ready and let's get started. Right then, we're going to begin this program with a warm-up, and we're going to start with some seated mobility exercises. So what I want you to do is, in your chair, I just want you to walk your hips a little bit further forwards so you're sat on the front half of the chair. And then that way then you can sit yourself up nice and tall, and it'll make it a little bit easier when we're doing these mobility exercises. We're going to start off with an ankle mobility first. So what I want you to do is start on your stronger side first. I want you to just move the foot out away from you, but making sure that you keep the knees slightly bent so you've got the heel on the floor. And the movement is going to be pointing the toes forwards as far as you can, pushing the foot away, and then pulling the foot back towards you. So basically you're pivoting on the heel that's on the floor, but make sure you keep this knee slightly bent. So move the legs a little bit further away from you, and then in your own time, just pointing the foot forwards and then pulling the foot back. So we're going to start off on the stronger side first, so that will give you an idea of how to do the exercise. We'll do about 5 of these each way, and then we'll switch over and we'll do the same on the weaker side. So that's 3, do a couple more, 4, one more, and 5. Good. Right, bring that foot back in. Let's do the same on the weaker leg now. So moving the leg out in front of you. Again, make sure that you keep the knee slightly bent with the heel on the floor. And then from there, again, we're going to just let the foot push forwards as far as you can, and then pull the foot and the toes back as much as possible. Now that bit, if you've got a particularly weaker side and you get any drop foot, this is the bit that's going to be quite difficult, is trying to then pull the foot and the toes back towards you. You're going to find that quite difficult. So just work with as much movement as you can. That's 3. Let's do a couple more. Pull back as much as you can. 4, one more, and 5. Good. Okay, right, bring that foot back in. So now we're going to move from the ankle up to the knee. So to do the knee mobility, what we're going to do with this one is we're going to start with the stronger side again. This time we're going to straighten the leg out fully to get the knee to go completely straight with the heel on the floor. And then I'm going to pull this foot in. See if I can tap the toes on the floor, trying to get the knee to bend as much as possible. So we're going from heel to toes. Okay, we're going to do 5 of these on each side. So straighten the leg, heel out, pull in, toes on the floor, and get the foot as close as you can to your chair. So heel with the leg straight at the knee, and then toes with the knee bent as much as possible. That's 3, 4, and 5. Okay, right, let's switch to the opposite side. So on the weaker leg. So just be careful with this one when you straighten the leg out. Make sure it's controlled. You don't want the knee to just suddenly drop. So straighten out the leg, control it, let the knee go straight, and then pull the foot back in. Bend it as much as possible. This bit's probably going to be more difficult on the weaker side. Getting the toes on the floor to bend the knee as much as possible. So nice and controlled as you go out, leg straight, and then bend the knee as much as possible. Don't worry if you don't get as much movement as this on your weaker side. Just work with what you've got. Try and get as much movement as you can around the knee. This is the focus of the movement. Just get as much as you can. That's 4. We're going to do one more. And 5. Good. Right then. So now we've gone from ankle to knee, so now we're going to move up to the hip. So for this one, you're going to bring your feet together and the knees together to start off with. Again, we're going to start working on the stronger side leg first. So the movement is just to let the knee go out to the side as much as possible, allow the foot to roll over, and then bring the knee back into the center line again. So we're going to do 5 of these on each side. So let the knee drop out, and then bring it back in, get it as close as you can to your other knee. So that's 1, 2, see how much movement you can get in that hip. Obviously this is the stronger side first. 3, 4, one more, and 5. Good. Right, let's switch over to the weaker side. So I'm going to put my hands on the stronger leg knee. So be careful again, make sure it's controlled as you take it out. Don't just let it flop out to the side, but take it out as far as it will go, and then really focus on trying to bring the knee in as close as you can to the other one. So that's 1, 2, 3, good. Just a couple more. 4, and 5. Brilliant. Right, bring the feet out a little bit wider again. So now we're going to move from the hip up to the spine. We've only got one spine, so you don't have to work on each side for this one, but we are going to turn each way. So just relax your arms down in front of you. And what I want you to do is make sure you're sat up really tall. So think about your posture before you start this one. And we're going to rotate the spine by basically turning the shoulders, twisting the torso to face one way, and then come back through the center, and we'll do the same facing the other way. So we're going to go 5 times each way. So if you want, you can start to turn the body towards your stronger side first. So twist, make sure you stay up nice and tall, and come back to the center, and then twist the other way. So that's 1. Same again, twist towards the stronger side, come back to the middle, and then twist towards the weaker side. That's 2. 3, make sure you're still sat up tall, so think about your posture while you're doing this. 4, last one each way, and 5. Good, and then come back to the middle. Right, next one, we're going to move up from the spine into the shoulders. So this is where we're going to do a shoulder roll. So again, start on the stronger side first. What I want you to do is I want you to lift the shoulder up towards your ear. So get it up as high as you can, like you're shrugging the shoulder up. Squeeze the shoulder blade back behind you, and then let the shoulder drop back down and come forwards again. So that's going to be like this roll movement that we do with the shoulder. So again, sit yourself up tall, stronger side first, lift, back, drop, and then come back to the front. That's 1. So see how much movement you can get into that shoulder as you take it all the way around. That's 3, 4, one more, and 5. Good. Let's go to the weaker side one now. So again, same thing. I'm keeping my hands on my knee just to give my arm a little bit of support. And then from there, we're going to lift the shoulder up to the ear, squeeze the shoulder blade back, let the shoulder drop back down and come forward. So that's 1. So get as much movement as you can on this weaker side. 2, so we're really starting to activate those muscles on the top of the back. 3, 4, one more, and 5. Good. Okay, we've just got 2 left to do. So now we're going to move from the shoulder to the elbow. So for this one, what you can do is you can actually cup your elbow with your other hand if you want to provide a bit of support, but you don't need to if you don't want to. So the movement from there then is I'm going to straighten the elbow as much as possible with my palm facing up to the ceiling. And then I'm going to bend the elbow as much as possible, bringing the palm of my hand up to the shoulder. So we're just focusing on that movement of the elbow joint. So again, up nice and tall, straighten that strong side arm out first, and then bend it, bringing the hand right up to the shoulder as much as you can. That's 1, 2, 3, 2 more on this side, 4, last one, and 5. Good. Right, let's switch over to the weaker side. So this is where you may need to cup your elbow with your hand just to provide some support for the shoulder. So once I've got a hold of it, so the movement from there then again, palm facing up as you straighten the elbow out, get as straight as you possibly can, and then bend the elbow, bring the palm of the hand up towards the shoulder. So that's 1. If you've got some high tone in the arm on this side, you may find as you're bending it, it might come up and do this. That's okay. Just get as much movement as you can, particularly on this straightening phase. Try and get that elbow straight as possible before you come back up. That's 3. Let's do a couple more. That's 4. 1 more. Good. And 5. Okay. Right, the last one we're going to do is move from the elbow down to the wrist. So on this one, again, I'll start on the stronger side. I'm going to relax my arm down onto my thigh. So the wrist is just off the end of the knee. Palm facing up to the ceiling again. And then the movement from there then is to try and open the wrist up as much as possible. So the fingers are pointing down to the floor. And then I'm going to close the wrist up as I bring the fingers up, pointing towards the ceiling. Again, try and get as much movement around the wrist as you can. So start on your stronger side first. Open it up. And then close the wrist off. So that's 1, 2, some clicks going on in my joint. 3, 4, 1 more, and 5. Good. Right, let's go to the weaker side. So again, try and get the hand over as much as possible. If that's difficult, you can do it this way in a neutral position and go left and right, or if you need to, you can go up and down that way if that's easier. Just do whatever feels right for you, but if you can go and supinate this so the palm's facing up, it will help to open up the wrist a bit more. So same thing. So we're going to open the wrist up, fingers pointing to the floor, and then close the wrist, fingers point up. So that's 1, 2, 3, 2 more, 4, last one, and 5. Good, and relax off. Okay, right, so we've finished that little warm-up of those mobility exercises. What we're going to do now is we're going to go on to the strength exercises. And with these, we're just going to purely try and put as much emphasis as we can on your weaker side. So for this, you're going to assume that the right side is my weaker side. So we're going to start off with a sit to stand. Now a normal sit to stand would be sat on the front half of your chair. Your feet are a bit wider than a shoulder's width, toes pointing forwards, but the feet are level before you stand up. Now what we want to do is we want to try and place a bit more emphasis on your weaker leg. So for what we're going to do for that reason is we're going to bring this foot back about 1 inch closer to your chair, and the stronger side leg, I want you to move that foot a little bit further forwards, about 1 inch. So basically we're just offsetting the feet, so the weaker side leg is closer to you, the stronger side leg foot is a little bit further away. And that will place a little bit more emphasis on this leg as you then do the stand. So the movement from there is I'm going to sit myself up tall with the feet slightly staggered, lean the body forwards, so I'm trying to get my chest over my knees and over my feet, and then from there I'm going to drive through the floor to push myself up to standing, and then on the way back we want to do that a little bit slower, so we're going to pop the hips back, control it down slowly, start to bend the knees, keeping the feet as they are, control, 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 until you're back into your chair again. So we can explode up quite quickly, but I want you to make sure that you come down really, really slowly, because that's going to help work into strength, particularly in that weaker side. So for this, it doesn't really matter how many you do. We're going to do it for 2 minutes. But I don't want you to do it particularly fast because we want to try and work into strength. So we might end up just doing 5 or 6 of these over the 2 minutes. So set yourself up ready, stagger your feet so that the weaker leg foot is a bit closer to you and the stronger side foot's a bit further away. 2 minutes of these, get yourself ready and off we go. So leaning the body forwards and then push yourself up, get yourself to standing, make sure you get your balance before you then control it back down. So hips going back, control the descent, slow, 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 until you slowly get back down into your chair, and then we go again. So leaning the torso forwards, push through the feet, drive yourself up to standing, get your balance, slowly as you go back. Now you may find as you go through these sit to stands, naturally your brain will be telling you, well, this is quite difficult because you're putting more emphasis on your weaker side. So you're trying then cheat. And what you'll do is you'll bring your weaker side foot further forwards and you'll start to slide your stronger side foot closer back to the chair. So each time you sit back down, just have a little check of your feet to make sure that they haven't started to slide around too much. So you can always then reset if necessary. Slow and steady. Keep control on that descent. Good. We're already halfway through. So I think we've only done about 3 or 4, but this is about the right speed. So we don't want to do too many, because we're not making it aerobic. We're just trying to challenge the muscles to work really hard, but particularly on this weaker side. Good. So make sure as you're going up and down, just check your knees. Sometimes there's a tendency for the knees to start to collapse inward. So we don't want the knees in, we want to keep the knees out so they're the same width as your feet throughout the whole movement as you're going up and down. Control it, control it, control it. Stick that bottom right back. Okay, probably got enough to do one more because we're coming up to the 2 minutes. Slow, slow, slow. Good. Well done. Brilliant. Right, that's the first one done. The next one we're going to do is we're going to do a straight arm pull to work around your shoulder. So for this one, we need to be back up to standing. And we're going to be using the therapy band that I mentioned in the intro to make sure that that's anchored to a point in front of you. So I'm using the banister here as my anchor point. You want the 2 ends of the band and you want to use your weaker side arm to get a grip of right on the ends of the band, to get a grip on it. Now, if your grip's been affected by your stroke, what I suggest you do is use your other hand for a little bit of support, but it's probably a good idea to wrap the band around your wrists. Okay, so then you've got hold of it this way. So if your grip begins to go a little bit, the odds are the band's not going to fling out the way. It'll stay relatively close to where your hand is. It might slip a little bit, but you'll be able to still keep control of it. Arm's going to stay straight. Now you can face your anchor point either with your feet to shoulder width wide, or what I tend to prefer is to actually move one side back. And because I'm using my right arm, I'm assuming this is my weaker side, my right foot is slightly further back, so I've got a little bit more weight onto my front foot for balance purposes. It's also a good idea to make sure that you're close to support, so I'm staying close to the wall here for balance purposes as well. And with the arms straight, it should be just slightly in front of you. That's where you begin to feel tension on the band. So we don't want it to be slack and start like this. We want to make sure that there's a little bit of tension in the band so it's beginning to start its resistance. And the movement from there is you're going to then keep your arms straight and start to pull that straight arm back as far as you possibly can, keeping the shoulder down and back. When it won't go any further, then return it back to the start position. So that's going to be the movement. So we're just working around the shoulder. Really important to keep the shoulder blade down and back as you do the movement, and try and keep your arms straight at the elbow if you can. It might start to bend a little bit, but by doing that, we'll take a bit of pressure off the muscles that we're trying to activate on the back of the arm. So that's why I want to try and keep the arm as straight as possible. Again, we're going to do 2 minutes on this one. So set yourself up ready with your band. If you need to make it slightly harder, you can move yourself further away from the anchor point. That'll increase the resistance. To make it easier, just go a little bit closer. So find a point that feels right for you. Ready? 2 minutes, off you go. So keep that shoulder blade down and back. Pull that arm back against the resistance of the band as far as you can, and then slowly return back to the start. So nice steady movement. Feel the resistance really working those muscles on the back of the arm, you'll feel it. But you might also feel it around the back of the shoulders and the upper back a bit as well, especially if you're trying to pull the shoulder blade back. So what we don't want to do is we don't want to end up keeping the shoulder forwards and trying to pull the arm back. So the shoulder blade needs to be pulled back. As you're pulling the arm back, feel the tension on the back of the arm. Slowly return it back to where it started. So don't let the resistance control your movement. You control the resistance band. So when it's going from there, don't let it just come back like this. Make sure that we're bringing it back slow and controlled, because that's where we're really working into the strength of those muscles in the arm. Good. So make sure you can maintain good balance. Again, hopefully you're staying close to your support. We're halfway through this one for the 2 minutes. Already I'm feeling that on the back of my arm. So if I'm finding it's getting a little bit too much, all I'll do is I'll just step a little bit closer to the anchor point, which will make it a little bit easier. And everyone's going to be slightly different with this one, depending on how much strength you've actually got and how much movement you've got in your shoulder. Some people might find they can only do this. That's absolutely fine. If you can get some movement in the band, great. That's what we're looking for. Don't think you've got to try and take your arm right back behind you. Just go as far as you can so you can feel those muscles activate on the back of the arm. Good. So probably be able to get about another 2 of these in. If you do them slow and steady, keep that shoulder going right back as you pull the arm back, but without twisting the body. So shoulder down, shoulder back, arm back, squeeze, and relax. Fantastic. Right, that's your second one done. So we're now going to move on to the third one, and this is where you're going to need your step. So whether you're using the step, the bottom step of your stairs, or if you've got a designated step like I've got here, whichever you've got will be fine. So what I want you to do with this one is make sure that you are close to something that you can hold on to. So I've got my banister here that I can hold on to with my stronger side hand as a support, because this isn't a balance exercise. This is trying to work in strength on your weaker side. You've got 2 options to do this. The first option, which is the easier one, is you lead with your strong leg to go up onto the step as you come up, and then you lead with the stronger leg to come down. And that's the bit where you're then working on this eccentric phase as you lower on this weaker leg. That's where you're going to get the work into the weaker side. So stronger side to go up first, and then stronger side also to come down first, working on this side only on the downward phase. If you want the harder version, then this one's going to work both ways. So we do weaker side foot goes up onto the step. So that's the one that's going to power you up onto the step. And then the strong side comes down first. So again, we're working on the weaker side as you then lower back down. So easier version is strong side up, strong side down. Harder version is weak side up, strong side down. So I'll let you choose which one you want to do. Make sure you got hold of your support. We're going to do 2 minutes again. And off you go. So I'm going to choose weaker side up, the harder version. Up nice and tall on the step. Make sure you get your balance on the top before you come back down, and make sure this foot clears the step before you begin to lower. What can sometimes happen is that we don't get that other leg to clear the step as it goes back down. So make sure that foot goes right the way back behind you, then lower down on this weaker leg, slowly as you come down. Up to the top, get your balance, slow on the way down. So again, we're looking at quality, not quantity. We shouldn't be going for a high rate on this one because we're working into strength, really trying to focus on this weaker side. So slower the better on this, particularly on the way down. Slow and steady, control it down. Just make sure you keep an eye on that knee of the weaker leg, particularly as you're going down, to make sure that it doesn't come inward. So make sure it stays in alignment with the toes as you lower back down again. Control. Good. So you should be starting to really feel the muscles working in that weaker side leg. And if you're doing the harder version like I'm doing, and that leg is getting a little bit tired, just have a rest for a bit, or you can always opt to going into the easier version where you take the strong leg up first and then the strong leg goes down first. So that's the easier version. Good, slow and steady on the way down. Hopefully you're feeling that in the leg. Let's see if we can get one more in. Good, that's your 2 minutes. Brilliant, okay. So the next one we're going to do is we're going to go back to the band. So for this one, we're going to be working into the muscles around the torso, into the waist, because we're going to provide some rotation for the spine like we did in our warm-up, but we're going to do it against the resistance of the band. So for this one, you can actually go, I'm going to grab it with my right hand, assuming this is my weaker side, but I'm also then going to use my left hand just to then grab my right hand to make sure I keep support. It doesn't really matter which hand you grip with this one, because you're not actually pulling with your arms. All we're doing is we're using that as a point where you can then twist your torso as you go left and right against the resistance. So you're not actually using your arms for this one. So grip it with the stronger arm if you want to, or with the weaker arm, entirely up to you which way around you want to do it. I'm going to hold it in my weaker hand. So the movement from there is I'm going to keep the anchor point to the side of me, and that should be opposite to the side I'm working. So right side is my weaker side, so the anchor point is to my left. If my left side was my weaker side, then I'd be doing it this way round, because I want to be pulling with the left side to go out. So make sure it's on the opposite side to the side that you want to work. Have your feet about a shoulder width wide. You want to make sure you've got your arms out straight with the band, and it should be slightly angled to one side. So if imagine a clock, you're my 12 o'clock dead in front, I've got 11 o'clock to 1 o'clock is the movement I'm going to try and go with. So I'm starting at 11 o'clock, I'm keeping this triangle between my arms and my torso, keeping that triangle shape, and then from there I'm going to twist and rotate as I go out, keeping the hips facing forwards, and then control it back as I twist my shoulders back to the start point. So literally exactly the same as what we did with the warm-up with this rotation of the shoulders, but now you're doing it against the resistance band. So set yourself up ready. Again, we're going to do 2 minutes. Ready? Off you go. So rotate, twist. Make sure you're standing up nice and tall. So really good posture with this one, because then that way we can really start to target these muscles around the waist, these core muscles. Good. Again, quality over quantity. So we don't want to go fast on this, keeping it nice and controlled. Really feel these muscles work here on this side around the waist as you twist your shoulders. If you feel it more in the shoulders itself, that might be, there's going to be a little bit of tension in the shoulders anyway with the resistance band, but you don't want to be pulling with the arms. You really want to be thinking about just keeping that locked in place with the shape that you've made, and then just rotate the spine. So I'm twisting. So I'm really focusing on thinking about these muscles that are doing the movement rather than my arms. So I'm moving it as a complete unit. Arms and torso stay still, and I just twist the whole thing as I rotate round. Good. Twist. Feel the tension. Control it back. So as your muscles begin to fatigue in the torso, there might be more tendency for you to start to pull with the arms. Try not to do that. Just try and keep it as a complete solid unit, and it just means you might not be able to twist quite so fast. So even if you just come to 12 o'clock and then go back to 11, that's actually okay. If you can't get right the way across to my 1 o'clock point, just work with what you've got. Good. Okay, see if we can get one more in. Squeeze it across. Make sure you're up nice and tall still. Slowly control back. Good, and that is your 2 minutes. Well done. Right then, we have 2 exercises left. So the next one we're going to do is to work around the hip, so we can focus on this muscle on the back of on the back side and the back of the legs. So for this one, again, we're going to go up onto one leg, so there is going to be a little bit of a balance element for this one. So that's why I want you to stay close to your support. But again, assume this is my weak side, this is the one that I'm going to work. The movement is to stand up tall, put weight onto my stronger leg, and then from there I'm going to lift my weak leg foot off the floor, and I'm going to try and extend the hips. That basically means I'm going to take my leg back straight When it won't go back any further, I'm going to then try and hold the position of the upper leg, but just try and bend the knee as I'm trying to get the heel of the foot towards my bottom. Then that'll straighten out, this will drop forwards. I then want to put my weight on it just for a second or two, just to stabilize those muscles, and then I'll revert back and then I'll start the motion again. So it's kind of like a very slow walking movement, but we're focusing on this phase, which will give you the push-off phase when you're walking, to activate these muscles on the back of the leg and into the back of the hip. So get close to your support so you can keep hold of that with the stronger arm so it doesn't become too much of a balance issue. Set yourself up ready for 2 minutes. Ready, off you go. So weight on your stronger leg, extend the hip, then bend the knee as much as you can, and then control it back, bring it back down, put that foot on the floor, lift the other foot just for a second, go back to the stronger side foot again, and then start the process again. So extend the hip, bend the knee, straighten the knee, relax the hip, put the weight on the foot, take the other foot off the floor just for a second, go back, start again. So that's the movement. Now, again, depending on how much the strokes affected you in terms of your impairment and your ability for this, you may find this bit quite difficult, particularly my experience dealing with stroke patients is particularly getting this bit, find it very, very difficult to really start to extend the hip and then also to bend the knee. So again, just work to your ability, do whatever you can. Just try and tell the brain to say, right, I'm trying to open my hip and then I'm going to try and bend the knee, and then I relax the knee, relax the hip, put the weight on it. Don't let the hip drop back when you put the weight on it. So keep the hip forwards, back onto the strong side foot, open up again. So you'll feel these muscles here and here working as you take the leg back and then bend the knee. And then as we put the weight on it, we're working deeper into the hip. Extend, bend. Good. Put the weight on it. Back to the other one. Good. Hopefully you're starting to feel that working into the back of the leg. See if we can get one more in for the last few seconds. Good, brilliant. Okay, that's your 2 minutes. We've just got one exercise left to do. Now for this last one, in the strength exercises, you can do this one standing, or if you prefer, if you're a bit concerned about your balance, you can actually do this seated. But essentially what's going to happen is you want the band to be wrapped around the upper back, like that. So you've got the two ends just in front of you, and then you're going to use the weaker side hand to grip, not right on the ends of the band, but quite close. So effectively the band stays relatively tight all the way around your torso, and you've got two ends of the band here within your grip. If you need to use the other hand for a little bit of support, fine, but the idea is we're just trying to work through this weaker arm. So the movement is kind of like a pressing movement, like you're pushing your arm out in front of you, but you've got the resistance of the band. You can do this if you're doing it standing, do it close to support for balance purposes, so feet shoulder width wide. The elbow will start off out to the side initially, so the movement is I'm going to draw my elbow into the center, like I'm pulling my elbow in towards my ribs, as I begin to then straighten the arm out in front of me. So I'm stretching the band, and then control it back. As the fist comes in, the elbow will then start to drop out. So we're working on the muscles on the back of the arm, deep into the shoulder. There's a lot of work going on to the shoulder with this rotation as well, and a little bit into the muscles in the chest. So basically that's going to be your movement. If you prefer to do this seated, then obviously exactly the same thing. Just make sure while you're seated, you're sat up nice and tall. Make sure the band is up around the shoulder blade still. And then same movement is from there, elbow comes in, and then we're just pushing the arm out straight as much as you can to work against the resistance of the band, and then control it as it comes back in. So I'll let you choose whether you want to do it standing or seated, because we're going to finish seated anyway, so it just means you'll stay there after this one when we do the stretches. Okay, set yourself up ready. 2 minutes, last one, off you go. So bring the elbow into the center as you push your arm out straight as you can get it. Control it back in, and then that'll release off slightly, and then start again. So push out in front, Good. You'll feel that as you begin to really start to straighten the elbow. It's also bringing the elbow into the center, so not leaving it out to the side like this. Draw the elbow in before you begin to push the fist out in front of you, stretching the band, because that's then going to work a lot deeper into the shoulder. So elbow in, push the arm out straight as you can. Again, depending on your ability or depending on how straight you can get your arm, how much movement you might get. You might only get a little bit of movement. Even if it's just a case of starting off with the elbow out here and then thinking about drawing the elbow in a little bit, and that's all you get, brilliant. Whatever you can get with the movement is great, because it just stimulates those muscles and it gets your brain to tell those muscles you want them to switch on and work for you. Good. So elbow in, bring it in as close as you can. Keep it in close as you begin to press. So I'm feeling that now on the back of the arms, and I'm also feeling it a lot around the shoulder. So it's a really good exercise if you've had any shoulder issues from your stroke. This is a good exercise just to start to build up some strength and help with the stability of the actual shoulder joint. So keep the elbow in nice and tight as you push. Good. Might be able to get 1 or 2 more to finish off these 2 minutes. Good. See if we can get 1 more in. And that is time. Brilliant. Okay, relax that one off. Pop the band to one side, you won't need that again. Good. Okay, so what I want you to do now is I want you to go back to your chair, because we're going to go back seated and we're going to finish off with a few stretches. So for these final few stretches then, firstly, I want you to make sure you're sat near the front half of your chair. It's going to make it a little bit easier for you to actually perform these stretches. And also secondly, I want you to make sure as you perform them, you're sat up nice and tall, unless I tell you for something slightly different. So the first one we're going to do is a back stretch, and also to stretch out the arm a little bit. So I want you to use your stronger side hand to grab hold of your weaker side arm wrist. Sit yourself up tall, roll the shoulders forward, so let the shoulders just to drop forwards, and then think about there, you're going to use your stronger arm to help and aid the weaker arm to be pulled forwards. Just do it gently. There shouldn't be any pain with this one, so if you find any pain in the shoulder, you've gone too far. Just keep the shoulder down, so don't let it pop up. And just find that point until you can feel some form of stretch. It'll either be in the arm, it might be around the top of the back. All we'll do is we'll just hold that position for about 20 seconds. Focusing on relaxing your breathing, so nice, slow, gentle breathing. Good, and then release off. Okay, so the next one we're going to do is we're going to stretch the muscles around the back of the arm, the triceps, and we're also going to work into the shoulder a bit as well. So let's start off with the stronger side arm first. I want you to bend the elbow as much as possible, like when we did the mobility exercise in the warm-up. And then you're going to lift that elbow up and back as high as you can, as though you're trying to get your hand to go down your back. And you'll create a stretcher on the back of the arm, but you might feel a little bit around the shoulder as well. So again, we'll hold that for about 20 seconds. Good, and release. Right, let's switch over. So if you need to support your weaker arm, you can grab hold of the wrist. Bring the hand up towards the shoulder first of all. So trying to get the elbow to bend as much as possible. And then if you can, start to lift the elbow up. If you want to change your hand position to the elbow and assist it once you've got the elbow bent. So here or here, wherever you need the support. Just find that point until you feel a bit of a stretch, either on the back of the arm or around the shoulder. Again, shouldn't be any pain. If you've gone into pain, you've gone too far, so just release it off a bit. Good, and release. Okay, so next one we're going to do, this one's a little bit more tricky, is we're going to stretch the muscles on the front of the hip, which can sometimes get tight if we're sat down a lot of the time. So what I want you to do is I want you to twist to one side. So I've just got one bottom cheek on the edge of the actual chair. And then this back foot, I want to slide back as much as possible along the floor. So the knee's almost on the floor. You can rest it on the floor if you feel that you want to. But from there, I'm going to then think about pushing my hip forwards, sitting up tall, and you'll feel a stretch here on the front of the hip, and you might feel a little bit down the front of the thigh. So just make sure you've got enough stability and balance on your chair, so don't compromise your balance in the chair. Hold that there for a few seconds. Good. Okay, bring that foot forwards. Let's switch over. So you're gonna have to turn yourself around. So the back foot now is the one I want to slide back as much as possible. If you need to, you can put the knee down on the floor. Let's see how far that foot will go back. And then from there, sit yourself up tall. Get the stretch here on the front of the hip of this back leg, and you'll feel a little bit down the front of the thigh. Good. Okay, bring that foot forwards. Bring yourself back round so you're back facing the front. So we want to keep the feet really wide for this next one because we're going to do an adductor stretch for the muscles on the inside of the legs. So feet out as wide as you possibly can, knees out as wide as you possibly can. Then you're going to rest your elbows just on the top of the knees. And then you can lean the body forwards to get more of a stretch. And you can also use your arms just to push the knees outwards just gently to create more of a stretch as well. So either way, leaning the body further forwards, but keeping good posture so you're not bending over the spine too much, but using the elbows to push on the inside of the knees to push them outwards. Good, okay. Right, the last stretch we're going to do is to stretch this muscle on the back of the leg. So if you straighten out one leg in front of you, you want to try and get the knee as straight as possible with the heel on the floor. Just relax the foot for this particular one. And then resting the hands on the opposite knee. If you sit yourself up tall, that might now engage a stretch on the muscles down the back of the leg. If you don't feel anything yet, keep your posture, but think about bending at the hip so you're trying to take your belly button further forwards, and that'll create more of a stretch on the hamstrings on the back of the leg. Good, okay, come back up, bring that foot back in. Let's go on to the opposite side. So straighten out the leg, try and get the knee as straight as possible, relax the foot, hands on the opposite knee, sit yourself up tall, and if you don't feel a stretch on the hamstrings yet, keep your posture, just bend at the hip, so trying to take your belly button further forwards to get more of a stretch on the back of the leg. Good, bring that foot back in, and that completes your strength and mobility workout. Well done. I hope you enjoyed this exercise program today and are feeling better for it. If so, please give it a like by clicking the thumbs up button below and consider subscribing if you haven't already. You can check out the description below for links to similar workouts on this channel that will help you with exercise after a stroke. But thank you so much for watching, and until next time, stay active and keep moving to feel better.